Hello and welcome to Fertility Fact or Fiction, our show every week where we talk about all things related to infertility and try and dispel the myths and bring you the truth about what you need to know to have a successful outcome. We're super pleased to be with you guys tonight. We have a great topic that was driven by your comments last time and a whole lot of likes and interest. So we're going to review Mosaicism, and it's less a review of a paper, although I do have one to review with you. But kind of a general review of the topic. So hopefully you guys all have your tea, coffee, and some time to spend with us tonight. And as always, we will be answering your questions live. So if you have any questions, don't hesitate to ask. You can start asking now, and we will go back and look at them later on. But we always spend the first few minutes just talking about a specific topic. So we're going to talk about mosaic embryos tonight. So the reason that this became an important topic was because there was a big shift in IVF going back probably 10, 12 years ago, where they first discovered the ability to determine if an embryo was genetically normal or not. So way back in the beginning, they were actually biopsying day 8 embryos, removing one of the cells, analyzing it, and then determining if the embryo was normal or not. Unfortunately, that turned out to be very harmful for embryos. And so very quickly, they realized that was not the right way to do it and that they should jump into doing the biopsies from what's called the trophectoderm instead of the inner cell mass on a blastocyst. So I'm going to explain that in plain English. When your embryo makes it to the blastocyst stage, which is typically day 5, day 6, day 7, at that stage, there are two different groups of cells. So there's going to be there's going to be an inner cell mass, which is the portion that's becoming the baby. And there's going to be trophectoderm, which is the portion that's becoming the placenta. So when we do endometrial biopsies, or not endometrial, embryo biopsies, what we do is we laser hatch the embryo by drilling a little hole with a laser in the shell of the embryo, right where the trophectoderm, which is the placental portion, is. And as the inner cell mass expands, because it's a growing population of cells, it pops through that hole. And so a little bit of tissue will come out and around that little drilled hole you've made with the laser. And it's trophectoderm that's coming through. And then you can take the laser and trim off more pieces. And you're now sending that off for assessment. So what they realized was that they could determine that there were genetic abnormalities or not based on what the placental tissue showed. After they started doing this for quite some time, people started realizing that some of the cells in that trophectoderm had normal genetic makeup, meaning 46 paired chromosomes, and some of them had abnormal genetic makeup. So you could have pieces missing from chromosomes, you could have whole chromosomes missing, or added pieces or added whole chromosomes. So that was then called a mosaic because, like a mosaic tile, you had some that were one shape and some that were another, and all of these pieces kind of fitting together. But they didn't know what that meant in terms of the inner cell mass, because no one wants to touch the inner cell mass and damage embryos, because that's where the baby is. So we assumed that all of those embryos were genetically not normal. So as time went on, people actually started getting a bit more worried because not everybody will make normal embryos. And so the question was, what do we do with these half normal, half abnormal embryos? Is there any chance that they're going to implant? And the answer to that was no one knew. So they started analyzing this more carefully, and then they started differentiating it into what's called high-level mosaicism and low-level mosaicism, and there's no agreement on what that is. But at the end of the day, what ended up happening was that the scientists and the geneticists and the labs all said, we need to decide whether or not these are worth transferring. So after extensive counseling of patients, people did start transferring mosaic embryos into women, and they ended up getting live births. In fact, there's only a couple of reported cases where a mosaic embryo was transferred, resulted in a pregnancy, and the baby or the infant actually had a genetic problem. once you're pregnant with the mosaic embryo, they were finding that they were normal. So then people started scratching their heads and saying, wait a minute, what's going on? So how do we analyze this? So essentially what they've done now is spread this into two segments, these high-level mosaics, where depending on which manuscript you read, somewhere north of 40% of the cells are abnormal. So you've got that normal population and the abnormal population of cells mixed in together. If more than 40% of the sample is abnormal, they call that a high level. Some arguments say 50%, some even say more than 20%. And then if it's less than that number, then you have a low level mosaic. So the question then that followed was, well, what are the outcomes from these low level mosaics? So several studies have been done. And if you look at the American Society of Reproductive Medicine conference that's coming up, the abstract for mosaicism has like 50 or 60 papers in there. It's crazy. There's tons and tons of studies coming out where people have specifically been looking at this mosaic question. And probably one of the most important studies came out in fertility and sterility back in July of last year, where they examined a huge number of these mosaic embryos, over 1,000 of them, to see what the chance would be for implantation. So I want to kind of go over that study, and I think Tarek's got some stuff there for you to look at. So essentially what they did was, this was a multi-center study. It included clinics from California, New York, a couple of places in New York, Taiwan, Milan, Italy, Rome, Italy, another one in Rome, and then one in New Jersey. So they had huge, huge numbers of embryos available to them. Specifically, I think there were over 5,000 normal or euploid embryos that were being transferred. And then they had 1,000 of these mosaic embryos, and 860 were used in single embryo transfers. 88 of them were used in double embryo transfers with another mosaic embryo. 50 were used where they put in one mosaic and one normal. And then there were a few more where there was no testing and they just kind of blended them all together. So essentially they went through the data, and if you go to, I think, the first figure 1, have you got that? So if you can look at the bottom part of it, because the top parts are not that critical, the bottom part will show you implantation, ongoing live birth, and spontaneous abortion. So hopefully you can see it. The first bar says euploid embryo. So they had great implantation rate. It was 57.2%. So very, very robust numbers, a good solid implantation rate. If you have a mosaic embryo, looking at all the mosaic embryos, these would be ones that had just segments of chromosomes added or missing, or an entire chromosome added or missing. You had 46.5%. Now that is lower, and it was statistically significantly lower than the 57.2, but still pretty robust results. I mean, you're still getting almost half of those embryos to actually implant, which is hugely important. And then if you had embryos in that third bar where the whole chromosome was added or deleted, that was 41.8%. So again, remember, these are all embryos where some of them are normal and some of the cells are not, and it's mixed in together. So then they went and looked at the ongoing pregnancy rate, and in this study, you're seeing 52.3% that had an ongoing pregnancy if the embryo was normal, versus 37% for all mosaic embryos, and then 31% if a whole chromosome is added or missing. So obviously the mosaics, where it's not just pieces of chromosomes missing, but the whole chromosome missing, are a little bit more difficult to achieve implantation success with. So then they looked at spontaneous abortion, and if you have a euploid embryo, your miscarriage rate is still substantial. It's 8.6%, and that's an important number for everybody to know, because everybody thinks if they do PGTA, they're reducing their chances of having a miscarriage. But the truth is, you're still going to get miscarriages even with euploid embryos. We don't know why. There are a variety of different possibilities. It does go up quite a bit with these mosaic embryos. You're now looking at over double 20.4%. And then if it was the whole chromosome, it's 25%, so a further increase. And again, all of those are statistically significantly different from the euploid embryos. When you went and looked at it in terms of the different mosaics, looking at positive outcomes and so on, and the different severities of the mosaicism, again, they have lots and lots of robust numbers. But the one that's really important to look at is that they're not seeing a huge difference in implantation and ongoing pregnancy rate with the mosaics that had less than 50% versus greater than 50% if you're already pregnant. So once you're pregnant, that difference of less or more than 50 doesn't really make a huge difference. You're still getting reasonably robust outcomes with that. So what they said from all of this is essentially that if you have a mosaic embryo, you have a very reasonable chance, if it's a low-level mosaic, that you will get implantation. And once that implantation has occurred, your chance of having a live birth is actually very reasonable. They've got an even better study, which I tried desperately to find for you all today, to demonstrate, where they actually blinded the physicians to whether or not the embryo was genetically normal or not. And then they told them to go ahead and do the transfers. In that study, there was actually no statistically significant difference between the euploid embryos and the mosaic embryos that were low level, meaning some of the reason that we're seeing these differences in numbers in these other studies is because of bias, because they're cherry picking embryos for patients. Whereas if you don't actually know what the embryo is and if it's normal or not, you can actually get the exact same results with the mosaics and the euploid embryos. Now, that was only one study, and the majority of other studies do suggest that when you're putting in a euploid embryo, which is genetically normal, versus the mosaic, you have a better chance with the euploid embryo. But that one study is actually quite well done, and as soon as I can find it, I will put it up on our site for you to take a look at. And it does demonstrate that the mosaics seem to have the same potential. And it was about 50%, I think it was 46% in that study that I read, demonstrating a very reasonable chance that that low-level mosaic can implant. So the question then everybody has is, well, what's happening in that embryo? So the answer is, in the trophectoderm, the part that becomes the placenta, you can actually have different populations of cells and still have a normal embryo. More importantly, there are studies out there where they went back and biopsied the inner cell mass and even re-biopsied the trophectoderm and showed huge discrepancies. So in particular, one study showed only 16% of the embryos that they called mosaic were still mosaic when they repeated the biopsy. Some had differences in what they found, so it looked like the first sample was wrong. Some showed that it was completely normal the second time around, and other ones demonstrated that there were abnormalities that they hadn't picked up before, which were showing that it was quite significant. But the important thing is the agreement from the first biopsy to the second biopsy was only in the 10 to 15% range. More importantly, when they've gone back and actually biopsied the inner cells where the baby is, which thankfully they are not doing a lot of because there's all sorts of moral questions with that part, the reality is that those inner cell mass cells are all coming out normal in these low-level mosaics, or many of them are coming out normal. What they're realizing about these embryos is that the embryos actually have the ability to kick out the abnormal cells from their cell population. And therefore, even if you start off with some cells that are abnormal, the embryo actually knows how to correct itself in some cases and can get rid of those abnormal cell lines from the portion that's becoming the baby, so that even if the placental tissue is abnormal, the inner portion can still be normal, and therefore you can result in a normal baby. So the statement, and they've got other studies on this as well, that you should just discard all the mosaic embryos is no longer true. In fact, there are people now arguing that if you have a low-level mosaic, it should actually be classified as a euploid embryo. it should be classified as a normal embryo because it's going to give you roughly the same implantation potential, maybe a slightly higher miscarriage rate. But otherwise, you still have a very good chance of ending up with a genetically normal baby at the end of that transfer. So the other 2 points that came up when I looked at this, which were very, very interesting for me, are that they are saying that once you pass that stage where it implants and it goes on, you no longer really have to worry if you make it past the miscarriage risk about the embryo. You're likely going to have a genetically normal child. Most people would still advocate for doing an amnio so you can actually get fetal cells rather than placental ones. But it does look like the result is going to be that you have a very realistic chance of ending up with a normal child. The other thing that's interesting is that, or 2 parts actually. One is that normally with age increasing, we see an increasing number of genetically abnormal embryos, but mosaicism actually decreases with age. So women that are older are going to have to deal with this less than women that are younger because their embryos tend to be just kind of outright abnormal instead of mosaic abnormal. So your age will play a role. It's actually protective from mosaicism, but at the same time, it's got a much higher risk of having abnormals. The other study that is coming out, and I think it's just in abstract form right now, and it's being presented at ASRM, is that if you have a higher percentage of mosaic embryos than normal, then even if you have euploid embryos, the euploid embryos have a lower chance of staying or sticking and staying. In other words, if you have, let's say, 3 or 4 mosaic embryos, a couple of aneuploid embryos, and 1 or 2 euploid embryos, those 1 or 2 euploid embryos are going to have a lower chance at implanting and remaining compared to the patient that has 1 or 2 euploid embryos and then has only a couple of mosaic embryos, like maybe 1, and then has whatever number of aneuploids. So the lower the number of mosaic embryos that you have, the better your chances are, even with your genetically normal embryos. And that has not been shown yet. So that is a very, very interesting study that's coming out. So this is a very rapidly evolving area. Literally in 2019, the Pre-Implantation Genetic Diagnosis Group division of ASRM issued a statement, and then literally a year later, they basically retracted it and said, well, now we have a different statement because they were realizing that these mosaic embryos actually do have implantation and ongoing pregnancy and live birth potential, resulting in normal pregnancy outcomes. So is it a fact or a fiction that your mosaic embryos have a lower chance of implantation? Actually, we don't know yet, but it actually looks like it's a fiction. Overall, it would appear that you're going to get a very reasonable chance of success. And if you are successful and it attaches and it continues to go, your chance of having a normal baby is quite high. Now, should you check to make sure the baby is okay? That's certainly something that is available. You can do NIPT, you can do amniocentesis, there's CVS. But realistically, once you've got an ongoing pregnancy, the chances of a normal pregnancy are quite high. And it's very, very few reports of genetically abnormal children being born from mosaic implanted embryos. So I think this is overwhelming for a lot of people because many of you have embryos. And they do have studies now looking at, should you do another cycle of IVF if you only have mosaic embryos to create more normal embryos, or should you go ahead and use the mosaic embryos? And I would actually argue that it is entirely reasonable to use your mosaic embryos before having to go ahead and do another cycle, unless you're trying to do embryo banking, which is a different story. But if you've done a cycle and you have 1 or 2 low-level mosaics, you actually have very good chances with those, and they should be tried before you spend all that money again to go for another cycle. You do need genetic counseling. It's a long discussion. You got to understand your risks and your benefits, but it is well worth considering that those embryos have a very solid chance. So I hope that you've enjoyed that part of the show. We will definitely have that up on our YouTube channel soon.